Hi, I'm Danica Koopmans.
And I'm Sharon Hughes-Geekie. We're your hosts of Docs of Vernon. This is an interview and podcast series designed to help you navigate the healthcare system and get to know the physicians that provide your care.
Topics include what the heck is a hospitalist, treating addictions, and alternatives to going to the ER, plus so many more.
This is your link to healthcare in your community. Welcome to Docs of Vernon. I'm your host, Sharon Hughes-Geekie. Today I have the pleasure of speaking with Emma Corbett, a resident first year at Vernon Jubilee Hospital. Welcome, Emma. So tell me a little bit about what it's like to be a resident.
Definitely. So being a resident is we are learners, but we're learners who have completed our medical degree. So we've done usually a degree beforehand, then a 4-year degree in medicine itself. We write exams, we have MD and doctor in front of our name, but we're not independent people who practice yet. So we are learners who are basically almost kind of apprenticing to become doctors at this point. And so that training will be anywhere from 2 to 5 to sometimes more years. And at the end of that, we are then able to practice independently and we write board exams.
So if a patient comes into the hospital and they get a resident, what does that mean?
So when they get a resident, they're getting a physician who's a learner. So what that means is we kind of will be managing their care, but also we'll have the oversight of one of our attendings or preceptors who basically comes and double check what we're doing and who we report to. So in a way, it's kind of like you're getting 2 doctors for one. And we usually have a little bit more time because we're learning and developing and growing our skills in patient care.
That's excellent. What has been your favorite part of being a resident?
Ooh, favorite part of being a resident? That's a really hard question. I've really enjoyed it. We have a really good group in Vernon. So we're the first year. So we're kind of the inaugural year of having residents or doctor trainees in Vernon. And the group of 4 of us have just been such a joy to work and learn with. Everyone here has been lovely. This is out of all the hospitals that I've learned in, which has been many at this point, this has got to be one of the most friendliest. And so I've really enjoyed that aspect of it as well. Everyone just seems so keen and open and willing to talk with us and work with us. It's been fantastic. I've really enjoyed being home. I love the patient care. I just really am enjoying the whole process.
Excellent. So you're going in for family medicine. Do you plan on being a hospitalist or are you looking at having a family practice?
So what my goal is I've loved family medicine, clinic medicine. I love the idea of having a little clinic with some people around me, following the same patients for years and years and years and just really getting to know them. That's my ultimate goal. I think though the happiest family doctors I've worked with have always been ones that have a little bit of a mixed practice. So maybe 4 days a week of clinic and then 1 day a week of doing something a little more specialized. In family medicine, there's a lot of opportunities to kind of subspecialize in different things. So I haven't quite decided what I want to subspecialize in yet, but it could be something like obstetrics, so low risk births, it could be palliative care, it could be addictions medicine, it could be a more mental health focus, it could be surgical assist. There's so many options, so kind of sprinkling a little variety in there.
Well, I'm sure our viewers who are looking for a family doc are going to be very, very pleased to hear that you're going into family practice and looking at being a family doctor in the community. When people look at going to law school, when students out there are thinking, wow, should I get a degree in medicine? Should I become a doctor? It seems like such an overwhelmingly huge goal to go through all those years of school. How was it for you?
I've loved it personally. I loved the whole process. I've loved learning. I've even loved some of the crazy night shifts and long hours. I haven't minded that at all, but I also acknowledge it's quite a long and quite difficult process. You do get quite little sleep depending on what rotations you're on and what you're doing, and the hours are long. And it's interesting because you're working, but at the same time you're learning. So it's this combination of, even when you go home, you're not done yet. You're still prepping for the next day, or you're reading around the patients from the day before who you're going to be seeing again the next day. So it's kind of a full-time, quite all-encompassing, life-absorbing thing to be going through.
And you're looking at staying in Vernon, and you took your undergrad degree in microbiology in Vernon, and now you've stayed in medicine.
Or at UBCO. I was in Kelowna for that. No worries. But
UBCO.
nearby.
UBCO. We kind of think of it as ours as well. You have practiced elsewhere during your time. Tell us about that. You were in Quesnel for a while and Victoria for a while. Tell us about that experience.
So kind of the process of medical school itself is the first 2 years, it's a lot of kind of more classroom learning, and you do 1 day a week that's in clinic or in hospital. And then in second year, you kind of are located in one hospital. So I was located at KGH in Kelowna, and we rotated through basically every specialty in every ward and learned so much. And then in fourth year, they really let you kind of go free in the sense of you're learning in so many different hospitals with so many different people. You're doing 2 week to 4 week rotations, and you're moving every 2 to 4 weeks and doing something else. And so in fourth year, I did a 4 week elective, so up in Quesnel, which was an amazing experience, kind of a rural hospital, rural clinic. You really get to see people who do everything in a smaller town. And even in residency, we do similar things in electives in my second year, so next year. So I'll be spending 2 months up in Prince Rupert doing more rural medicine.
Nice.
We'll see.
And then you were in Victoria as well. How did that differ from Quesnel?
So, I mean, resource-wise, my rural rotations such as Quesnel, and I also did a month up in Port McNeill, those are much smaller centers. So kind of when you're working in the emergency department, you have to think about how do I get this person to care that they need, which is sometimes a helicopter, usually a helicopter if it's serious, or perhaps it's ambulance. It's just a different level, whereas in Vernon, we're super privileged in the sense that most of what people need is local. We have scanners locally. We have lab that's available 24/7. We have imaging that we can just send people to, and it's always available. But in these different places, there's none of that. You maybe have an x-ray if you're lucky. Maybe you can call in the lab tech, but it's a totally different experience to here. And to Victoria, which is even more kind of resource rich in the sense of there's every specialty, and it's got a lot of the various subspecialized things. So for example, one of my 2 week rotations in Victoria was medical genetics, which is a very subspecialized branch of medicine.
Excellent. Well, thank you so much for speaking with us today, and best of luck with the remainder of your residency and your others to come. I was speaking with Emma Corbett, a resident at Vernon Jubilee Hospital. I'm your host, Sharon Hughes-Geekie for Doctors of Vernon. We'll look forward to seeing you again soon.